Hi, my name is Giuliano. It's a pleasure being here with you to do this presentation in name of ICCPR, who invited me for this presentation in the AACVPR Congress. It's a pleasure being here to talk about Brazil and how we are dealing with the COVID and the cardiac rehabilitation, where we are standing in Brazil nowadays. First of all, I would like to thank all the services that I'm representing now. These are the services that I work here in Brazil, and I would like to thank them for all they do for me. One important thing to start our presentation is to show you how Brazil is dealing with the coronavirus nowadays. And we are seeing nowadays, as you can see here, we still have the 50,000 cases a day. We are decreasing this number every day, but we are still in a high level of COVID, and we are dealing with that. We were worse in a few months ago, and we are still trying to deal with this. Our intensive care units are getting a little bit empty nowadays. We were full 2 months ago. Now we are dealing with this in a better way. Other important point, as we are trying to get up from this situation, is the deaths in our country. As you can see, in April, we have more than 3,000 deaths a day. And now when we look for the last data that I had before this presentation, we are dealing with 197 cases a day in the average of this last 7 days. It's still a high number, but we are seeing a huge decrease in the death cases, and this is good for us and also for the cardiac rehabilitation programs, because we are starting to receive a little bit more patients as they are getting willing, as they are willing to go out and try to reach their old habits and the rehabilitation programs, as I said before. The reason for this improvement in the numbers is probably, I'm sure that they are related with the vaccination. As you can see here, we have an amount of our people, 35.10% nowadays are fully vaccinated. One dose, we are reaching 68% of our Brazilian. And then this is good for us because when I talked in the past about this, in April, for example, we have only 5% of our country vaccinated. Now that we are in September, we have 38.8% fully vaccinated. This is good because the old ones are starting to get courage to get out of their houses and go to the parks, to the academy, to the gym, to practice exercise again, which is a signal for us that the rehabilitation programs are going to increase. An important data that I'm supposed to present you is related to the coronavirus and the cases that are recovered nowadays. We have more than 20 million people who are recovered from COVID. And as you can imagine, post-COVID symptoms are very frequent in this population, and we are supposed to receive this population. Other important data is related to the mobility. As you can see in our country, people are starting to go out of their houses and start to, as I can say, live again, start to work. As you can see, the movement, when we see the mobility trends, start to increase in the working places, for example, which shows the tendency of our population to go out. And especially as I can see when I go to the gym, we can see that the people are starting slowly to frequent that environment again, which is good for rehabilitation also. And I'm supposed to show you this data from now on. When you see the cardiovascular rehabilitation in Brazil specifically, as I was presenting the data from deaths and cases in our country, vaccination, now we are going to take a look for the rehabilitation itself. To do this, I selected 3 programs in our country to try to present 3 different regions from our country and what they are doing their rehabilitation programs to deal with this problem of COVID and the lack of patients in a way. So I'm going to present my service here in the middle of Brazil. Other one from the south, cardiopulmonary, is a huge clinic in our country. Another one from the northeast, which is Actus Cordius. So I'm going to speak about 3 different programs and show you how they are dealing with the problem of COVID since the start of the pandemic until now. We are going to start from cardiopulmonary. As you can see, they remain closed for 6 months from March to September of 2020. They remain closed, and you can imagine how they suffered with this, and the patients also. When they opened, we could see adjustments in the environment, decrease in the number of patients, 12 to 4. So they are dealing with a budget problem, as you can imagine. We see 1/3 of the original patients go into the gym to practice exercise. They started wearing the proper personal equipment for protection, distance protection with all the equipment with plastic film, alcohols in 70 alcohol, and also using these methods for during and after each procedure. For example, if a patient go to use a dumbbell, for example, they clean the dumbbell before and after the patient taking in his hand that equipment. When we see the audience going to the rehabilitation, we can see that the audience has changed. As you can see, from September 2020 to March 2021, 95% of the patients who were going to the clinic were post-COVID, and this clinic was used in the past to be specifically a clinic for cardiopulmonary patients. And you can see now in this phase of the pandemic, only 5% of the patients were from the original kind of patients, as you can imagine, cardiovascular or respiratory patients. Nowadays, we can see from April to now, we can see that 55% of the patients are still post-COVID and 45 are the original ones from the cardiovascular and respiratory diseases. So the things are starting to get in okay again. Another data is that since the beginning of the pandemic, this clinic, for example, adapted itself for the telerehabilitation programs, and we can see an average of 10 patients per month being assisted with a telerehabilitation program. And as you can imagine, this clinic is a huge reference in our South region, and they try to do this assistance with other states and other cities from the region itself, and it's working well from them. They are able to get some money with this and sustain their budget and their incomes. Other data who are important for our presentation is that from April to August, we can see 19 evaluations per month. So the patients start to coming back. And when we see the average rehabilitation time, the post-COVID patients remain in the clinic for 1 to 3 months. And the cardiovascular ones, the regular ones from the past, since the beginning of from before the pandemic, they are still remaining a little bit more time with the physical therapies from 3 to 6 months. So we have a point. The rehabilitation for the post-COVID is faster than the rehabilitation for the cardiovascular and respiratory patients from the past. These are Dr. Polet and Dr. Bonin, who are responsible for this clinic. Another one is Actios Cordios from Bahia, and they also data. They stopped the treatment in the first wave of COVID, and last year, 60% of the patients stopped going to the clinic. 25 maintained their assistance in the clinic, and 15% went online. In the second wave, we had a huge impact. 30% of the pre-pandemic patients being attended in person individually in the clinic. And September 21, they started a home care service since April of this year. And together with the face-to-face assistance, they account for 70% of the numbers of the patients seen before the pandemic to start. 50% in the clinic and 20% at home. So they are still dealing with this problem of COVID, but they are slowly getting up on their feet and trying to survive doing their assistance. These are Dr. Pet and Dr. Marvin, who are the responsible ones from the Actios Cordios service. The third one is my service here in the middle of Brazil. As you can see, we were closed from March to July. 5 months is completely closed. After the reopening, the patients slowly started to show, but with a different profile from the cardiovascular and pulmonary one for the post-COVID nowadays. So October 20 until now, the post-COVID patients are the majority of my patients in my rehabilitation center. 70% of the patients are post-COVID. Now, as we can see, a huge increase of the patients demanding assistance. We are creating a second clinic with an individualized assistance, individualized mode to to perform. As you can see, first-class rehabilitation. This is the environment that we are creating, and of course, this is only for the people who are able to pay for this. This is not a program for everybody here in our country who has huge problems of budget and income. As you can see, also in our country, we have a problem. Large rehabilitation centers it's clear for all of us that they are unsustainable nowadays in the private sector. A lot of friends of mine are suffering. Some of them opened in this kind of environments before the pandemic, and now they had to close it because they don't have the income to sustain this kind of problem. Now, with the budget problems, it's not easy to deal with this. So we are changing gears for smaller spaces and personalized assistance. This is the environment that I send my patients. As you can see, we have only 5 patients at a time with distance and also the personal proper equipment for protection. But this is the outcome. This is the environment that we are dealing nowadays for our rehabilitation. Other point is that the tele-rehabilitation and also the home-based rehabilitation is increasing in our country and will continue to rise. The problem is, as I consider some drawbacks, lack of equipment for training progression. It's not easy for the physical therapist, the exercise physiologist to play all the, how can I say, to do their stuff in a easy way because they don't have the equipment for doing it also. So we are trying to create some solutions, and we have to be creative to deal with this, but it's a tendency in our country to deal with the home-based rehabilitation. I really believe that it will increase even more. Other problem in our country, a serious one, a huge one, is that the government initiatives to create cardiovascular post-COVID rehabilitation center are definitely incipient. Our country, we are not dealing well with the pandemic. Our president is not seeing easily these things. They deny the vaccination, for example. It's not easy. And we have a huge problem of our country nowadays is the unemployment. With the pandemic, it's still terrible for us. More than 14 million people are out of job nowadays, which is a problem for the income for the patients to seek for the rehabilitation, the cardiac rehabilitation, as you can imagine. So to close on this presentation, common points among different rehabilitation services. First of all, many patients who attended rehabilitation in the pre-pandemic era did not return. They have been coming back little by little. It's not easy, but it's happening nowadays. We can see a slight increase in our movement. Some patients are still isolated and scared, especially the older ones. Family does not allow them to return in many situations, but the vaccines have made it easier. They are starting slowly to show again. Third one, many moved to beach house or the countryside and they are now unreachable. Tele-rehabilitation doesn't reach all of them, especially the older ones who are not familiar with the gadgets that we use to contact them. And the target of their rehabilitation has in part changed from regular cardiovascular patients to post-COVID patients. This is true. This is a picture of my family. They took it a few months ago. And I'd like to finish my presentation with this. I hope that at the end of this road, we can still be providing our services. May the light we see in this image illuminate us. And at the end this pandemic. This is what I have to say to you. It's a pleasure being here. Sorry for my spelling and speaking because it's not my native language. My native language was a pleasure being here with you. Best regards for everybody.